Our next speaker is Dr. DEEPAK Mishra. He is the Associate Professor, BHU, and he is also the Chairman ARC of Uttar Pradesh Society of Ophthalmic Surgeons. He will be talking on clinical diagnosis and differential diagnosis with TASS.
First of all, I would like to thank Mandi for including me his IC. The topics he has given to me is how to differentiate endophthalmitis with TASS. There is no financial interest. First of all, we all have to know why to differentiate. The differentiation is very much important because we know that both are common usually after the cataract surgery, but there are many other surgery in which we got the similar situation, but they have a different etiology. Clinical picture is looking just like same, but etiology is different, requires different treatment, and even prognosis is different. So these are the something which looks like a twin brothers but have lot of differences in between them. Endophthalmitis, I am not going in detail, as Dr. Mathur sir already explained we all that what are the types and how we know about the endophthalmitis, but for this I would like to say just note down or have some idea about the time period. If it occurs within 4 days, it is a permanent type, and most common organism involved is strepto and staph. If it is acute by the epidermidis or the fungi is not acute, common in acute, but it is common in the delayed. So it may occur after the 4 weeks sometimes. That's why the most of the surgeons have a protocol to follow their cases on day 1, day 7 and day 28 just for these delayed endophthalmitis. For the treatment is concerned, there are many aims and objectives for treatment. Our future speakers will tell them, but the primary objective for any treatment of endophthalmitis is to control or eradicate the infection, manage the complication and restore the vision, and secondary objective is whatever we can save our globe or symptomatically relieve. Now coming to the TASS. TASS is the something which is done, which is also inflammation, but it is an sterile type of inflammation, and the common causes associated with it is cleaning and sterilization failure somewhere, sometimes because of the IOL solutions, ointments and drop. Dr. Mathur sir wonderfully explained what are the cleaning protocols for OT and everything, so we can do. Also, I am not going in details how we can prevent this thing. Now coming to the main topic, what is the clinical differentiation between both TASS and endophthalmitis? So first difference is the onset. TASS is usually you have to see or anyone can see within 48 hours, means within 2 days. However, the endophthalmitis, earliest of the endophthalmic features occurs after 72 hours. So if you seen just after 6 hours or 12 hours or 24 hours, means there is more chances of TASS as compared to endophthalmitis. Second is pain. Pain is important feature. If any patients call you after cataract surgery that he is having lot of pain, it is not a simple pain, means heavy pain, then you can say intolerable pain, then it is more chances it goes towards the endophthalmitis. However, the TASS have mild reaction and mild pain too. Then coming to the discharge. Discharge in TASS is usually a watery discharge. However, in the endophthalmitis, since it is an infection somewhere, so it is a purulent. Here you can see the lid congestion. Here the lid congestion is of lesser types, but in the endophthalmitis, just see how severe lid congestion is. Now coming to the anterior chamber reaction, when you can see the anterior chamber reaction, since endophthalmitis is mostly because of the posterior segment involvement or the endophthalmitis in anterior segment. So here you can find out less hypopyon, but in case of TASS you will find out fibrin or the smaller hypopyon. Now this is the most I can say not most, but the most commonly feature which anyone can identify with by sitting on simple on a slit lamp. in the case of TASS, you have seen here from limbus to limbus, whole limbus, either right or left, you can vertical or horizontal, 360-degree limbal to limbal corneal edema is seen in the cases of TASS. But when we see endophthalmitis, it is usually localized or in some segment initially, later on it will move anywhere. So limbal to limbal corneal edema or the full corneal involvement as an edematous cornea is important feature of TASS. Another one is the IOP. IOP usually, if it is a real TASS, it may be normal to high, and for endophthalmitis may be normal or low. So IOP is not a much differentiating feature as compared to limbal edema. But yes, when you are able to see the fundus, then there will be a clear-cut differentiation that in cases of TASS you have seen the whole fundus is normal and clear, but when it is a endophthalmitis, then there is chances of vitritis or vitreous haze, so that you can have a different feature. So one we can say is the next one is the diagnosis, and the diagnosis for the TASS you have to, until unless it is proven by the culture and sensitivity, treat all. Sometimes we advise that treat all TASS as endophthalmitis until unless it is proved by the culture and sensitivity. So culture and sensitivity is important in both. If not responding, these are the treatment. If anything is happening in TASS, then intensive steroid or different treatment. But in cases of endophthalmitis, my next speaker will going to deal about all these things, so I am skipping this slide. Just a take home message for regarding the differentiation. Most time is, one is the onset, if it is less than 48 hours or more than 3 to 4 hours. Corneal edema, limbal to limbal are localized. Anterior chamber reaction less. In TASS where is more. Vitritis we have find out that is fundus is normal in cases of TASS, but when we go for this one endophthalmitis, then there is vitritis or the haze, and culture and sensitivity is important. So all these parameters anyone can have in mind while differentiating all these two similar things. With this, I again say there is no substitute of clinical examination as long as you are going to take the proper history, do the sterilization and check your sterilization protocol anytime, either it happens TASS or endophthalmitis. With these words, I would like to thank you. Thank you, Doctor.